Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Oxytocin and the vasopressin. So here the first one, the oxytocin and vasopressins, they are nothing but non-peptides. They are non-peptides which are synthesized. So non-peptides are synthesized within. So they are non-peptides, they are synthesized within the supraoptic. The supraoptic as well as the paraventricular. The supraoptic paraventricular nuclei of the hypothalamus. So supraoptic as well as the paraventricular nucleus of the hypothalamus, they are transported down the axon and they are stored in the nerve endings within the neurohypophysis, or the neurohypophysis, and also the posterior pituitary. So let's look at oxytocin. Oxytocin increases the force of uterine contraction. This is dealing with the oxytocin. Then when you look at the oxytocin, it is released during the labor. So oxytocin is released during the labor, and looking at the uterus is highly sensitive to it at this time. So however, it does not appear obligatory. So it does not appear obligatory for the initial parturition. Delivery occurs even if in case of the hypophyse-segmented animal. So it is even in hypophyse-segmented animal, and it is an facilitatory in action. Now the stimuli for the oxytocin release will be the coitus, also the parturition, and also the suckling. Next is vasopressin. So here in vasopressin, the stimuli for the vasopressin secretions, it will be water deprivation. Then there can be hemorrhages as well. There will be hypertonic saline infusion. Next is there can be decreased in the ECF volume, as well as the standing, the angiotensin 2, the clofibrate, as well as the carbamazepine. Now let's look at the types and the functions. The types is, let's look at V1A. V1A, what is the function? The V1A function is, it is located on blood vessels. So they are located on blood vessels, and what it does is it mediates the vasoconstrictors. So V1A, they are located on blood vessels, they mediate the vasoconstrictor effect of vasopressin. Next is we move on to V2. The V2, what it does, it mediates the antidiuretic. So mediates the antidiuretic effect, and this is of the vasopressin. So V1 is located on the blood vessels and mediates the vasoconstrictor effect. So it is present on the blood vessels and mediates the vasoconstrictor effect of the vasopressin. The V2 is, it mediates the antidiuretic of vasopressin by inserting the aquaporin 2. So there is aquaporin 2 into the apical membrane and or the principal cells, and this is of the CD, that is a collecting ducts. Then moving on to the V3, there is a mediate the increased secretion of ACTH from the corticotropes of the anterior pituitary. So what are the drugs which act against these receptors? The drugs which act against these receptors are nothing but the tolvaptan and also the canivaptan. So all these are the drugs acting against these receptors. So what are the disorders of the ADH? So disorders of ADH, let's quickly recap. There is a DI. So what is this DI? Is the diabetes insipidus. So there will be a decrease of 75% decrease. So 75% decrease or more in the secretion. So there will be a decrease in the secretion or action, and this is of the ADH, and this is known as the DI. So it is characterized by a large volume of dilute urine. So there can be a large volume of dilute urine. There will be polyuria as well as the enuresis and also the nocturia. Next we look at the SIDH. SIADH is the hypersecretion. So hypersecretion of the ADH, and due to the many different causes. So they can be due to the ADH producing tumor. So ADH producing tumor such as a carcinoma of the lungs or various organs, various drugs. There can be due to head injury as well. So all this is SIDH, hypersecretion of ADH due to many different causes. Ectopic ADH producing tumors such as the carcinoma of the lungs, the various drugs. The head injury is a large dose of the oxytocin. So all these can be involved. Then you also have the clinical features. The clinical features are due to the decrease in the secretion of water. So decreased secretion, this is of the water, and also the cellular overhydration. Next is, what is the treatment? The treatment wise, you can administer the tolvaptan as well as a conivaptan. So both can be used. Now let's quickly look at the vasopressin escape. So vasopressin escape is characterized by a sudden increase in the urine volume. So urine volume, what happens? It increases. It increases, and with a decrease in the urine osmolality. So urine osmolality, this will decrease. So increase in the urine volume and decrease in the urine osmolality, independent of the high circulating vasopressin. There is a high circulating vasopressin levels. So as in the SIADH. So this is due to a decrease in the aquaporin. There is decrease in the aquaporin 2 channel. So the decrease in aquaporin 2 channel and the expression in the renal collecting duct. So expression in the renal collecting duct. To learn and grow daily like this, please do subscribe.